Hello everyone and welcome. In this video I'm going to give you an example of the general format we'd like to see for your final projects that you're working on in your groups. The topic I'm going to look at is therapeutic touch, which is not a topic that's going to be an option for you. I'm just using it as an example to show you basically what we'd like to see in your presentations. So first of all, what is therapeutic touch? Right? The short answer is that it's a non-contact type of therapy where practitioners move people's energy fields to help them deal with pain, nausea, anxiety, and so forth. Now, what I want you to do is go to Blackboard and click on the link for the video that I have shown here, this Healing Touch program. It's a 2 to 3 minute video, but I can't show it to you through this program because I get terrible feedback. But it's important that you look at it so you can get a feel for what sort of videos are appropriate. Like this one talks about what therapeutic touch is and also gives testimonials from at least one patient as well as practitioners there. So please be sure to take a look at it. And when you're done, come back. All right, so I hope you watched the video and now you're back. And before we move on, we need to clarify what therapeutic touch is not, right? So therapeutic touch is looking at non-contact massage therapy, or what they're doing is massaging or moving energy fields in a hope to improve patient outcomes. It is not actual physical touch, right? Physical touch is very different and a very different set of data we'd be looking at. This is non-physical touch, movement of energy fields. So the question I want to talk about today here is, well, does it work? Does it actually have the impact on patient outcomes that practitioners say it has, as well as patients? So in the video you saw at least a testimonial from one patient who had gone through this treatment, as well as practitioners discussing the many benefits of the therapeutic touch. And if you look on YouTube or look online, you can find a lot of videos describing and showing what therapeutic touch is from reputable places. The University of Arizona College of Nursing, this is from Nebraska Methodist Health System, and there are others as well. I don't want to spend a lot of time on testimonials though, because although they are moving and inspirational, they're not data. Right? We always like to say that the plural of anecdote is not data. Collecting a lot of anecdotes isn't data. And the reason is because you're not collecting data under controlled conditions. When you're looking at just your own experience or other people's experiences, there's no control. There's no random assignment. There's no counterbalancing. And there's always a potential that you're just observing the possibility of placebo effects or participant bias or experimenter bias. So participants know that they're supposed to be sort of feeling better after this treatment, and that may bias them to say that they feel better. But also experimenters do things consciously or unconsciously that lead the participant to believe that they should be feeling better, which may be leading to these placebo effects. You could see one example in that video, like where the nurse asks, well, does this make you feel better? Right? That's sort of a biased way of asking the question even. If you'd ask, can you feel anything? Does this feel any different? You don't even have to ask it, do you feel better? Right? They're leading clients and patients to think that it should improve things. So while I was watching the video, I was wondering and thinking about whether or not this is pseudoscientific. And that is, does it elicit any of these ideas of the red flags of quackery or the things that we talked about in class about pseudoscience? And there are a number of things in the video that gave me pause and made me think about whether or not there are certain elements of pseudoscience here. One is that there were a lot of testimonials, right? It was just anecdotes of both the patient and practitioners saying it works, but there were no studies. They weren't talking about any data at all. Right? They also focused heavily on the idea that it's helping your body, right? So this, you're trying to relax people to allow their body to heal itself. They didn't have anything about secrets or conspiracies, but there is a bit of a conflict of interest in terms of, like, they're not selling a book, but it's also, they're making money off of this, right? People who are doing this practitioner of therapeutic touch do make money off of it. I'm also a little concerned about this idea of the miracle cure-all. It does seem to affect and be suggesting that it improves a lot of things like sleep, anxiety, pain, nausea, and then vaguely they just talk about other ailments. So it does seem to be a little broad and far-reaching in the possible cures. Right? So they don't talk about magnets or things like that or Western medicine, but it is this vague focus on energy. The idea that you have this biofield with this energy field around us, right? A lot of imprecise scientific language. They talk about this energy field and how they relate it to, they say it's like an EKG or MRI, but don't explain how it's like an EKG or an MRI. So there seem to be a lot of elements here of things that are not indicative of good science, right? A little pseudoscientific bend here looking at the data or looking at their testimonials. But to really dive into this, we want to look at what does the research say. So first I want to talk about a study that was done looking at the impact of therapeutic touch. Right? And so this was a clinical trial where they're looking at a variety of different dependent variables. Specifically in this study, they're looking at depression, pain, and sleep. And the measures they use for these dependent measures, the Beck Depression Inventory, I have an excerpt of it here up on the screen. That's a widely used, scientifically sound, valid, and reliable measure of depression. Right? That's a good measure of depression. They measure sleep quality with the Pittsburgh Sleep Quality Index. That is also used in lots of scientific research studies. It seems to be a good, valid measure of sleep. And then finally, they have a visual analog scale looking at pain, where people rate their pain on a 10-centimeter line from no pain to worst possible pain. And they just put a hash mark someplace on this line to indicate where their pain is. And then you just measure how far down the line it is, which also seems to be looking at research that this is a solid way that people measure people's pain. Right? So we don't have concerns about the dependent variables. They're all commonly used measures that appear to have good reliability and validity. Now, their independent variable is they have subjects receiving 8 therapeutic touch sessions, and they all receive them in a clinic, and they receive them twice a week for 1 month. And then the sessions were about 25 minutes long. The sample they included were 30 people, and they were all 60 years or older. Now, the way they designed this study is that basically it was a pre-test, post-test design. They measured all the dependent variables before treatment, then they gave them treatment, and then measured it again at the end of their treatment with the therapeutic touch. The results were clear in that they all had low p-values, and they found that literally everything got better, and that both people's pain level, self-reported pain, decreased, depression levels improved, and therapeutic touch also was associated with better sleep. Right? So they have really low p-values. They're all less than 0.006, I guess is the highest one, suggesting that the difference we're observing is probably not due to sampling error, not due to chance factors. Okay. However, the design they used was absolutely terrible. Right? This is an example we used in class as a bad design, where you measure your dependent variables, give the treatment, and then measure the dependent variables again. And there are a lot of possible reasons we might find improvement between time 1 and time 2. Right? So one possibility is people actually get better, have better sleep, less depression, and so forth after the treatment because the treatment worked. But there are other possibilities as well. It's possible they got better with time, that they just healed themselves in some way, got better. It's also possible, though, that there's a placebo effect, and that is that people thought that they were being treated, and that belief that you're being treated would actually lead to better outcomes. So if we think about this study in terms of causality, we have, they have covariation, right? They found a low p-value, but it's really important to note they had an extraordinarily small sample size of only 30 people, which means I'm pretty cautious in interpreting even the covariance there. They do have temporal precedence. I know that the independent variable came before the changes in the dependent variable, right? They manipulated therapeutic touch and then measured it afterwards. So I know that we have temporal precedence. But I can't eliminate confounds. It is very possible that the effect we're observing here is just a placebo effect. So a better research design would be to have two groups where I randomly assign people to either receive therapeutic touch or a placebo. In those two groups, I'd probably measure the dependent variables, whatever they are, then give people a treatment, and then measure the dependent variables again. And what I should see if the treatment works is that the therapeutic touch group gets better. But what I'm also going to find is that the placebo group gets better because of placebo effects. What we're looking for is more of an improvement in the therapeutic touch group than in the placebo group, right? That would be a better design, where literally these two groups have to be the same in every single way possible. So the placebo group has to believe they're receiving therapeutic touch, right? So basically, both patients need to be blindfolded, right, in both the therapeutic touch and the placebo group. So this is like literally a blind design where the patient can't know if they're getting the therapeutic touch or not. The practitioner will know whether they're doing therapeutic touch or not, right? But in either way, you need somebody just standing there, right? In the placebo group, you need somebody standing right where the therapeutic touch participant would be. And then in both groups, you're going to measure the dependent variables again. Now, they're doctors, they're nurses. Nobody else can know which treatment condition they're in because they might treat them differently if they know that they received the therapeutic touch than if they didn't. Right? That would be a good study. Okay. Now, when we look at the existing research in the literature, I'm looking at reviews of the literature in terms of narrative reviews, and ideally we would find meta-analyses. In this case, I'm looking at a narrative review back from 1984. And in 1984, the review of the literature revealed that there was simply no evidence that therapeutic touch actually had any benefit above and beyond a placebo effect. When people do well-controlled design studies with good control groups, there was no evidence that the therapeutic touch actually worked. In 1984 was a very long time ago. So a more recent study here, I think this one was done in 2020, where they looked back at more recent data on therapeutic touch and looking at a variety of different dependent measures like pain, anxiety, nausea, and so forth. And found that, again, that when you looked at high-quality studies, there was no high-quality evidence for any of the benefits claimed. When they do find results, it's typically because there's a low-quality study, either largely because of lack of control groups, poor control groups, which suggests that it's probably just a placebo effect. Right? So some studies show it works, but they're really poorly designed studies when they do show it works. So basically what the researchers are saying is that there's just no compelling evidence from any well-designed studies that it works. Also, there's just literally no scientific explanation at all for how it should work. It's not clear at all how or why we have energy fields around our bodies or how moving them should have this sort of impact. So it doesn't fit into our current knowledge about our current scientific knowledge. Right? So what's the harm? Well, the harm is a couple-fold. One is that therapeutic touch isn't free. Right? It costs money to have people come do this sort of practice in hospitals. And that time and money could be better spent on effective therapies. There are other therapies that are effective, and there simply isn't evidence to support this. Right? So we shouldn't be spending time and resources when there are actually effective therapies that do work. All right, so that is we're hoping that your talk will take about 15 minutes, and this is going to be about 15 minutes once you watch the YouTube video as well. And this is not an exact format you need to follow, but this is just to give you a general sense of what we're looking for to help you interpret the rubric, sort of what sort of things are we looking for there. Right? So I hope this helps. If you have any questions, please talk with your instructor and we'll help you with this.